In the 80s, Lori Brigham was a research administrator at Children's National when she was given the opportunity to lead a heart transplant coordinating program. It would become Washington Regional Transplant Community.
Lori went from 0 to 100 in her career because when she started, she had no real OPO experience. So she forms this group. She's reaching out to people she knows or have heard about in the OPO industry for insight and information and some guidance. And she takes that and forms it around what she sees as how we do things, and she evolves over the years.
The way that she was able to manage getting people transplanted, doing it safely, and building an organization where there really wasn't a roadmap. It was very much putting that program on its firm footing and building something from really absolutely nothing where there wasn't kind of that playbook on how to do it.
She was really looking for people that could communicate and had confidence in this emerging field, because we're thrown into challenging situations. And you didn't need to be a critical care nurse, but you had to be able to communicate, and you had to be able to have confidence in what you were doing, and that could make the difference between someone saying yes or no to donation.
Lori took a keen interest in improving donation, not just in DC, but across the United States. She helped establish universal donor criteria, led national collaboration, and was a thought leader.
And one that stands out for me is her work and contributions around data-driven decisions and measuring what we do. I mean, this has been a topic of conversation since we started back in the 80s, and it's still today part of that. But Lori was an author, one of the authors on the landmark first published paper around measuring organ donation potential. This was a super big deal. It was a publication that was in the New England Journal of Medicine, not a slouch journal, and it was the first national estimate of organ donation potential.
She had a great voice, a voice that was respected by the AOPO community, and she would stand up at annual meetings or any meeting where she was presenting, and she just helped us to think differently. She's just so bright, and she really broke down barriers.
She had a holistic approach and knew the value of building relationships not only with transplant surgeons and hospital executives, but frontline staff and nurses. And Lori always focused her attention on the communities we serve.
I'm always marveled at the way she managed diversity and led to change from the days of yore to what is now fashionable to have diversity, equity, and inclusion. This was her hallmark. And the thing that I admired most about her leadership style was that she put into action what she decided was necessary and never tried to get any credit for it.
In many ways, she's an unsung hero, and people don't really know the impact of her work. For example, when I drive to Children's and I see the flag, that means that there was a donation that was made. I can think about the kids that might have been helped or the other families that might have been helped by that family that helped make that donation. But that wouldn't have happened without Lori.
Lori had a unique leadership style and was relentless when advocating for our life-saving mission.
When she decided in her heart of hearts that the path was clear, there was no stopping her. However, she was thoughtful in getting to that decision. She could go toe-to-toe with a surgeon who took a strong stance, not that we physicians ever have a robust opinion, and yet host the annual donor family gathering with warmth and affection and just a general love for the people she was serving.
Lori has incredibly high standards from the time she wakes up in the morning, working with her team throughout the day, facilitating donors in the middle of the night, working with boards and so forth. She holds everyone to the same level of accountability and does it in a very graceful, respectful manner, which I've always very much respected.
She tried to really foster growth of the individuals as well as the teams that they were on. And I think she's pretty proud about that. She's had a lot of people get back to her over the years, recognizing that in hindsight that she did that for them.
I learned everything in the beginning, that first 2.5 years, that I still use today. When they call, you go. You show up. You talk to families. You do everything in your power to advocate for those patients waiting transplant.
Growing up, I don't even know how many donor family gatherings, and just seeing the attendance every year, year after year, the families there, everyone coming up to her, saying thank you for everything you've done. It really hits home like how many lives she's impacted.
You cried with us, but you also showed us that while people die, love never does. Rather, it can transform mourning into memory and infuse memory with meaning that can heal us all.
Countless patients and families have been helped, and the world's a better place because of Lori Brigham.
She's done that job as the CEO for so long, so well. I mean, who wouldn't be proud of her?